Let me start by talking about health. I think in Sierra Leone, you say, well, buddy, in Mende, say, Befa Kahui, we're talking about the whole person. So the WHO definition of health is a state of complete physical, mental, and social well-being. It's not just the absence of disease or infirmity. You're talking about the whole person, not just the diseases. How is this person performing in life? What makes them thrive and what makes them happy holistically is what you're talking about when you talk about their health. And I think it's best represented by what we talk about in Sierra Leone when they say, how do you body? They don't talk about how you tuberculosis or how you malaria. So with that background, with a common understanding of what health is, let's look at some of the figures in Sierra Leone that would bring reality to all of us. We have a little over 7 million people in Sierra Leone. The per capita health expenditure, how much money the government sets aside for everybody's health, is $140 a year. So if you go on your motorcycle and you break your leg, you spend your $140 right off the bat. So it's a small amount of money to cover your health needs for the whole year. Having said that, it's a lot better than a few other countries. We worked in Malawi for years. Their per capita health expenditure was about $65 a year. But if you compare that to the US is about $10,000 per person per year. If you look at the UK, it's $4,000 per person per year. If you look at Nigeria, it's $1,800 per person per year. So our health budget is really quite low. And you could see the numbers that come from that. The life expectancy in Sierra Leone right now is about 50 years for women and 49 years for men. If you look at maternal mortality, Sierra Leone unfortunately has the highest maternal mortality in the world, with 1,360 deaths, 100,000 live births. That means every 100 deliveries that you have, one mother will pass away. So that's the bleak nature of what we're dealing with. If you look at the health workforce, Sierra Leone has close to 19,000 healthcare workers in the whole country. The whole country, 19,000. And about 9,800 of those are paid workers. The other 9,000 are volunteers. If you look at the distribution of the health workforce, 70% of those small number of healthcare workers that we have are in urban areas. Only 30% are in the rural areas. But if you look at the population distribution, 60+% of the people live in rural areas. Only about 38% live in urban areas. So even the distribution of the few health workers we have is a little lopsided. So to just put this in better perspective, let's look at the actual healthcare workers. Sierra Leone has about 5,500 qualified nurses for the whole country. They have about 621 community health workers for the whole country. A country with the highest maternal mortality rate in the world has only 313 midwives in the whole country. And you have only 156 doctors in the whole country. The whole country of 7 million people. And only 41 specialists. A lot of these healthcare workers, you add into this factor, there are people who are doing administrative work as well. Some of them are hardly seeing patients. So we're coming from a very, very difficult position. Having said that, there's some real consequences of that. Look at the 10 leading causes of death in Sierra Leone. The number one cause of death is diarrheal diseases. Diarrheal diseases that are so easily preventable. The next one is malaria and neglected tropical disease. The third one is cardiovascular diseases, high blood pressure and things like that. You know, you're talking about neonatal diseases, neonatal disorders, you know, things that affect little babies. You know, you're talking about diabetes as the 5th largest killer in Sierra Leone. You're talking about HIV and AIDS as the 6th largest killer in Sierra Leone. The list goes on in unintended injuries, like all these accidents and motorcycle and car accidents. It's like the 8th biggest killer in Sierra Leone. And cirrhosis of the liver, with all the alcohol consumption, is the 9th highest lead. So I tell all of these stories not to create a bleak image, but that's the reality. And so what we want to do is, where do we go from that? You know, I think if we understand where we are, we're able to develop a pathway to get out of that situation, because Sierra Leone is better than that. So I would like to shift a little bit to just say, how do we do that from a human rights standpoint? From a rights standpoint. And this is the most important time in our lives, because we're celebrating the 70th anniversary of the Declaration of Human Rights. At the same time, this week, in Astana, Kazakhstan, they're celebrating the 40th anniversary of Alma-Ata. Alma-Ata Declaration was when they said primary health care is the most important way of addressing healthcare needs. So we have the 70th anniversary of human rights. We have the 40th anniversary of Alma-Ata here. What better moment for us to think of our health issues from a rights standpoint? So when we talk about rights, let's talk about what somebody like Hubert Humphrey, you know, the famous vice president, said about rights. He said, I quote, "The moral test of government is how that government treats those who are in the dawn of their life, that is the children, those who are at the twilight of their life, that is the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped." End of quote. So I think in looking at health from a rights standpoint, let's have that critically at the back of our minds going forward. I think every time we talk about health, we talk about those clinical things that we always refer to, the TBs and the heart disease and the diarrheal diseases. But I think we have to pay attention a lot more to the social determinants of health. What are the underlying social determinants of health that, if we don't address from a rights standpoint, would end up with these health outcomes that we're seeing on the other side? So what I want to do is to talk to you about some of these underlying social determinants of health around several parameters. Number one, looking at adequate supply of safe food and nutrition. If people don't have safe food and nutrition, no matter how many hospitals you build, you're going to have trouble. Looking at housing and transportation. If we don't look at people's housing conditions and the ability to move around, we're going to have these negative consequences in the clinical settings. Access to safe and portable water and adequate sanitation. How could people be dying of diarrheal diseases? No matter how many doctors and nurses we put out there, if we cannot provide safe water, portable water, and adequate sanitation, no matter how big the hospital is, no matter how large the doctors are, you will constantly be seeing them. So we have to be able to address these fundamental issues. Let's look at occupational and environmental issues. If you have malaria in country and people are not dealing with some of the mosquito control issues in your neighborhood, no matter how much malaria pills you have, you're going to be constantly dealing with malaria going forward. Access to health-related education and information, including information on sexual and reproductive health. If we don't have adequate education, equally distributed between rural and urban, between young people and old people, if we don't have adequate education around these health issues, we will see the effects of it on the other side. So, having said that, there are some key elements. If you address these key fundamental social determinants, there's some key elements that you have to look at. Number one is, I'll look through about 3 or 4 different elements. Number one is availability. So if you have all of this, is it really available to the people? Making sure that public health care facilities, goods, services, and programs are available in sufficient quality to include underlying determinants of health. Make sure we have hospitals, clinics, and other health-related buildings and infrastructure. Making sure that we have well-trained medical and professional staff. Make sure we have essential drugs. All of these available to the population you want to serve. The next major issue I want to talk about is accessibility. If you have all of these in there available, are they accessible? Do people have access to it? And you want to have accessibility from the framework of non-discrimination, so that if people are not discriminated against by their sex, by their tribe, by their region, by their political affiliation, by their HIV status, or by whatever it means, if you don't discriminate against people and give them access, they'll be able to better utilize the services that you have for them. So making sure that we have non-discrimination is really critical. Physical availability. You can have this big hospital only in Choitrams in Freetown, and my people are in Kamalo and in Demby, and they don't have access to it. So it's really important that we have physical accessibility. Economic accessibility, affordability. You could have the best hospital and the best services around. If people cannot afford it, it's going to be really challenging. Information, making sure that the information is available to all, not only in the public domain, but also in schools. Could we go back to the schools and start educating people? Because when you educate people in schools, they go home, they're the teachers at home as well. So let's go back to some of these fundamentals and making sure that the ethical considerations are a fundamental part of everything that we do. Having said that, the third major domain I want to talk about is quality. With all these drugs and products coming from all over the world, making sure that we have good quality medicines, making sure that people are trained appropriately, making sure that people have some strong ethical background in the delivery of services is going to be real critical. Now, having said that, what is the government doing and what's our role? I think, after the Ebola outbreak, the government worked with development partners to develop a clear strategic plan for what they want to do about rebuilding the country's healthcare system. It's very, very comprehensive. What we want to do is to make sure that that plan balances the approach between clinical services and these social determinants of health. And you could be a formidable pressure group in ensuring that that balance is kept in place, such that we have, in the health facility, you have adequate number of doctors. We cannot have a country with 155 doctors. A lot of these hospitals have more than 150 doctors. I work in the Grady system in Atlanta. Grady had 1,000 doctors in one hospital system. And for a whole country with 155, we could do better. I'm hoping that this country or the next generation of people will say, look, we are going to train 5,000 doctors over the next 10 years. We are going to train 50,000 nurses over the next 10 years. We're going to have mental health and social workers. We're going to train like 30,000 social workers in the country. I think that those are some bold steps that we have to keep the government accountable for and continue to put pressure on them. And they're willing because they're partners with us. It's also important that as they do this, we just don't focus on the clinical services alone. You need public health workers in the community. You have to have people who are in there who can say, hey, we have a pregnant woman in that village, and what does that pregnant woman need? How do we make sure that they have all of these services? We want to be sure that there's somebody who's going around to say, malaria is serious, could we clean our yard? Could we make sure we could reduce the mosquito population? So getting that balance right between the community work and the facility work is going to be really, really important. So what can we do as people in the diaspora? Two things I'll propose. One is to really work with the government and put pressure on them to be able to fulfill their commitments. Because you could have Alma Ata today, you could have this Human Rights Declaration, it could be just a piece of paper. People are busy doing things. it's important that the diaspora constantly reminds them and puts pressure on them and say, you have this commitment. And by the way, it's not just in the goodness of your heart, but by doing this, you're actually creating development opportunities and growing a country whose health is so fragile at this point. So you have a major role to play. Another role that you could play is, as the diaspora, to be able to have strategic engagement with the countries to supplement what the government is doing in some of these health interventions. I think the medical missions are critical. My only plea is, as you engage in these medical missions, look at the community as well as the facilities. So as you go in there, 500 people show up in the clinic, and you're dealing with that, just know that there are thousands of people out there who also need your help. So just get that balance right. And I think what I would say is, Sierra Leone is in a horrible situation, but we can change it. We have the capacity, we have the knowledge, we have the commitment, and let's stop finger pointing. We'll work with the government, we'll work with civil society, we'll work with communities, and turn this around.
Yes.
Because it is our country, it's our only country, and we will be there someday soon. Thank you very much.